Hi, my name is Jerry Lynn, and today I'll be teaching you about the talocrural joint, otherwise known as the ankle. So let's go! First, I'll be showing range of motion. The ankle does dorsiflexion and plantar flexion. To ensure that you get best results, you want to make sure that you put a towel or a pillow underneath the proximal knee. This is because the gastrocs are a two-joint muscle. Today we'll be using a goniometer. So for best practice, you want to line up the axis distal to the lateral malleolus, the stationary arm up with the fibular head, and then you want to stabilize the lower leg as well as the stationary arm. Then, when the patient is ready, you can instruct them to move their toes up towards the ceiling or dorsiflex, whenever you're ready. Okay, the movable arm is going to go towards the sole of the heel, and I'm getting a reading of 20 degrees, which is normal for dorsiflexion. Next, we'll be doing range of motion for plantar flexion. The parameters are still the same. You want a pillow underneath the proximal knee. The axis is going to be distal to the lateral malleolus. The stationary arm is going to be lined up with the fibular head. You're going to stabilize the distal leg as well as the stationary arm. When the patient is ready, you want them to put their toes towards the ground or plantar flex. Again, the movable arm is going to go towards the sole of the heel. I'm reading 50 degrees, which is normal for plantar flexion. Next, I'll be showing how to do manual muscle testing. Since the ankle does dorsiflexion and plantar flexion, I'll first be testing the anterior tibialis. So I'm going to put the foot into dorsiflexion and inversion, since this is the anterior tib's primary action. Can you hold this? Good. If the patient can hold the position against gravity, they get a 3 out of 5. Next, I am going to stabilize under the distal leg and apply pressure on the dorsum of the foot. I'm going to pull into plantar flexion and eversion. On the count of 3, go ahead and resist me. 1, 2, 3. 1, 2, 3, 4, 5. Good. I would rate this patient a 5 out of 5 because I was unable to break them during a gradual increase in resistance for 5 seconds. Next, I'll be doing a manual muscle test on the peroneus, longus, and brevis. I'm going to put the foot into plantar flexion and eversion because these are the primary actions of the peroneal. Can you hold? Good. So again, I would rate a 3 out of 5. Next, I'm going to stabilize at the lower leg or the ankle, and I'm going to place my hand at the 5th metatarsal and my thumb at the dorsum of the foot. I'll be applying pressure by pulling into dorsiflexion and inversion. So on 3, go ahead and resist my pressure. 1, 2, 3. 1, 2, 3, 4, 5. Good. Again, I would rate this a 5 out of 5. Lastly, I'll be showing muscle length testing. To ensure that you have a more natural gastroc length, remove the towel that was under the knee during range of motion testing. Then I'm going to place the foot into end range of dorsiflexion using my forearm. End feel for this should be firm. Once I have it in end range, I'm going to measure dorsiflexion just like I did for range of motion. Can you go ahead and hold that? Good. I'm going to place the axis at the distal to the lateral malleolus, the stationary arm up to the fibular head, stabilizing that, and then I'm going to measure. Currently I'm reading 30 degrees. Go ahead and relax. That would be a negative muscle length test because the degrees were actually more than active range of motion. A positive muscle length test would be less than active range of motion. Thank you for watching this video on the talocrural joint. Happy studies!